Hello everybody. Happy Tuesday. Yesterday I went live for the first time and I had fun, and I decided that I'm going to start doing lives frequently on different topics related to breastfeeding, pregnancy, labor, birth, postpartum, motherhood stuff. My background is as a labor and delivery nurse, a birth and postpartum doula, and a lactation consultant most recently. I do private practice and also work in 2 hospitals as a hospital lactation consultant. I also have breastfed 2 babies myself. I have a 2.5-year-old and a 7-week-old who I have exclusively breastfed. Today, I want to talk about mastitis, what causes it, how you can hopefully reduce your risk of getting it, and the management of it. So mastitis is breast inflammation. A lot of people think that it is solely a breast infection, but mastitis is actually inflammation of the breast, and a lot of the times when people are referring to mastitis, it is the breast infection. So you get mastitis when you have milk stasis. So if you're not moving milk frequently enough. Sometimes this happens when you go back to work, when your baby starts sleeping through the night, or if you start combo feeding or you're doing some weaning process. So that might be a change in feeding frequency or length. If you get engorgement and milk is staying in one place and not moving frequently, that increases your risk of mastitis. Clogged ducts can lead to mastitis. If you have a poor latch, your baby is having difficulty latching and you get nipple damage, so cracks in your nipples, that can introduce bacteria and lead to mastitis as well. Fatigue and stress can weaken your immune system, leading to an increased risk of mastitis. So those are some things that could cause mastitis to start. For the treatment of mastitis, we do want to be moving that milk frequently. So feeding baby on demand more frequently to keep that engorgement at bay, keep that milk moving. We don't want things sitting in there, milk sitting in there. You can do some gentle massage during the feed. You don't want to be doing vigorous massage. You don't want to be causing more stimulation in between the feeds, but during the feed you can be doing gentle massage towards your nipple to help move that milk. You can do a warm compress before the feed to get things moving, or a shower beforehand, but we don't want to be applying heat because it is an inflammatory process, so ice will actually help to decrease that inflammation. So you can do a little bit of warm compress or a shower before you feed, or pump to get that milk moving, but besides that, you don't want to be applying heat. And then in between feeds, you really want to reduce any stimulation, so you don't want to be doing any vigorous massage in between, and you can do ice for 10 to 20 minutes at a time to help reduce that inflammation. Ibuprofen is also going to help with inflammation. So if you're taking that for postpartum recovery, you can continue taking that for any inflammation of the breasts you have, and you can also reach out to your provider and ask for their recommendations. But ibuprofen is over the counter, so that is a safe bet for the inflammation related to mastitis. If you do develop symptoms like flu-like symptoms, fever, chills, body aches, extreme fatigue, that would be a call to your OBGYN. They will likely prescribe you an antibiotic. Sometimes they do milk cultures. But antibiotics are the treatment for mastitis. Just give me 1 second here. It is safe to breastfeed when you have mastitis. Baby can still receive that milk, and the provider should know that you are breastfeeding currently and give you breastfeeding friendly antibiotics. My own baby was hungry. Sorry for the interruption. So yes, the antibiotics are the preferred treatment for mastitis, and then continuing to feed frequently as well. You also want to avoid tight, restrictive bras. So wearing loose clothing is going to help to keep that milk flowing. And if you do have latching problems or pain with feeding, you definitely want to be connecting with a lactation consultant. The hospital should give you resources on discharge for who you can connect with. A lot of the times your pediatrician or your OBGYN will have lactation consultants there or can connect you with somebody in your community. They're a great resource. You always want to be reaching out to them with any concerns. So if your baby's having any decreased output, any signs of dehydration, extreme fussiness, or not feeding well, you'd want to reach out to your pediatrician. If you are having any pain or damage with feeding or any of those flu-like symptoms that could indicate mastitis, you're going to reach out to your OBGYN. Lactation consultants can do virtual or in-person meetings with you to troubleshoot what might be causing nipple pain and damage. A lot of the times it is covered by insurance. You can look on the Lactation Network and Wildflower Health to see if your insurance covers lactation support. And it will connect you with someone close by so that you have the option to do an in-person visit if needed. You don't want to let any breastfeeding problems continue for too long because it does increase your risk of getting mastitis, which can be pretty devastating for your breastfeeding journey. You can definitely resolve it, but a lot of people feel like the pain and discomfort warrants an abrupt end to their breastfeeding journey. And sometimes if you don't get it treated, it can lead to a breast abscess, which can require hospitalization as well. I am happy to answer any questions that anybody has. If you want to pop them into the comment section, anything breastfeeding related. Sounds like my toddler's coming inside. This might get difficult to do. I am going to sign off here because I hear my toddler coming in. If you have any questions, this will be posted so you can put them in the comments and I will follow up in the next live. Thank you so much for joining. Have a wonderful day.